Alright, good morning guys. I'm 𝗖𝗂𝘂𝗂𝗏𝗂. Long time no see. Welcome to Heart with our Dr. FB Live, presented by 𝗖𝗿 Medical Center, 𝗖𝗿 City. So, let's see what is the topic we're going to talk about. Today, we're going to share some information with you about bone cancer, 骨癌. Honestly, before this show, I would never think of actually bone can have cancer. Just because of that, out of curiosity, let's see how many of you actually have heard of bone cancer. If you have heard of it, can you please type yes in the comment? If you have never heard of it, can you please type no in the comment? Let's do a quick survey. However, if you have never heard of bone cancer, it's okay. That's the reason why we are here. That's what we are here for. And as a matter of fact, sometimes when you never heard of something, it doesn't mean it doesn't pose a threat. I think it will pose a greater threat because sometimes when you don't know something, that means you will delay the diagnosis and treatment. With that being said, it's always important we equip ourselves with the right information, with the right medical information from the right channel, and perhaps from the experienced and professional doctor. So who is our doctor today? She is our Medical Summit Center, 𝗖𝗿 City 骨科肿瘤外科专科顾问𝗖𝗵𝗂𝗧医生 is Dr. 𝗖𝗵𝗂𝗧. She specializes in orthopedic tumor and limb reconstruction surgery. Okay, guys, do you know what? In the whole world, in the global, we have about 500 bone tumor surgeons. And in Malaysia itself, we have about 10. Out of 10, only 2 to 3 doctors are full-time. Today, we are extremely lucky because we got one of them, which is Dr. 𝗖𝗂𝗧, to be on our show to share her experience with you. So if you have any question about the bone cancer, please don't hesitate to type out your question in comment. We'll try to answer all of your questions. On top of that, also for your information, with over 30 years of clinical experience, Dr. 𝗖𝗂𝗧 was the first Chinese female president of the Malaysia Orthopedic Association. 她是马来西亚骨科学会的第一位华裔女会长。She was also the ASEAN Orthopedic Association first female president. 东南亚骨科学会第一位女会长。With such a reputable and renowned doctor, you definitely want to share this information out to all of your friends. So please make sure you share our FB Live today. You never know. Just a simple action, just a simple share, you might save a life. Alright, also one more thing before I forget. Towards the end of the show, we have a quiz segment in which I will ask 3 simple multiple questions. As long as you pay attention through our show, you could answer it easily. And if you answer it correctly, potentially you can walk away with a Uniqlo gift card that's worth 100 ringgit Malaysia. So it's very super easy question. Just make sure you stay with us until the end of the show and just make sure you pay attention to our show. 3 questions will be asked, and if you answer it correctly, you may walk away with a Uniqlo gift card that's worth 100 ringgit Malaysia. Alright, without further ado, ladies and gentlemen, let's bring out our guest doctor today, which is Dr. 𝗖𝗵𝗂𝗧医生. Dr. 𝗖, let's say hi to our audience.
Hello, everybody. Good morning and welcome to the show.
Thank you so much, Dr. 𝗖. And then, guys, can you please welcome Dr. 𝗖 by giving some comments or even give some loves emojis or flowers emoji in the comment to replace the big round of applause to welcome Dr. 𝗖. All right. I think today we really have a lot of questions to cover, a lot of topics to cover. So without further ado, let's jump into the first question. So, Dr. 𝗖, in general, I think a lot of people, for myself, to be honest, I really never heard of bone cancer. I would never have thought of bone can have cancer. So in general, what is bone cancer?
Bone cancers are cancers that happen in the bone.
Okay.
They can be primary in the bone, or they can be a secondary tumor that spreads from some other primaries.
I understand.
Right.
So that means that you may discover the tumor in the bone, but that is not where it's originated
from. Yes.
Okay,
Yeah.
interesting. So is that considered aggressive?
Yeah, if there is a cancer that has a potential to metastasize, which is like spread to the bone, then it is usually an aggressive cancer.
I see, I see. So what age is the high risk for the cancer, for the bone cancer?
Bone cancer can happen in a very wide spectrum of age group. Usually, in the early phase of life, it happens in children who are growing.
Oh,
okay, like primary school, adolescents, when they started their puberty. So the bone is growing very fast.
Right.
So things go haywire when they were growing. So there is a period of high incidence, especially for tumors like osteosarcoma. Okay, so that happens in the primary age group to the secondary school age group. There are other tumors that happens later in life. Different tumor, they have different like favorite time when they happens. So for other tumors, for example, like another common bone tumor like chondrosarcoma, usually that happens almost all of them in adulthood.
I understand.
And it was like later in adulthood, like 40s, 50s, things like that. But there is a trend that the age of happening is moving a little bit younger these days. Yes.
So it sounds like what Dr. Chai was mentioning earlier is at different age range that there is one common type of bone cancer.
Yes, and later in life, when you are like in the middle age and beyond in the more the older age group, then the metastatic bone disease, which is like secondary bone diseases from other cancers like breast cancer, thyroid cancer, prostate cancer, kidney cancers, you know, become more and more common towards the later part of the age.
I understand. So we understand at different age range, you might have one common bone cancer. We will get into that in depth. But for now, in general, what are the symptoms of bone cancer? So our audience will know that when they should pay attention to.
Okay, patients usually present in the very early phase. It's like some kind of discomfort they feel.
What kind of discomfort?
That becomes more and more severe and become more and more persistent. And it's very common for Malaysians to take some analgesics, painkillers, or they go to some massage, you know, or try some traditional treatments and things like that. Then it doesn't work, and things become worse and worse and worse, and it affects them. Sometimes it affects them in the middle of the sleep. They wake up because of the pain, and that sets an alarm, okay, to the patient that something is very, very wrong, okay. Some of them may present with swelling, okay. As the tumor grows, we are talking about bone tumor. So as a tumor grows from the bone, sometimes it breaks outside the bone. So it becomes what we call an extra-osseous tumor. So when the tumor breaks outside the bone, it will start to invade the soft tissue around it, the muscles and sometimes blood vessels, nerves and all. And then the increasing swelling will start to be palpable. You can start to feel, there is a swelling in my leg or arm or something, and it is painful.
I understand.
Okay.
So it sounds like two main symptoms are, the first one is the pain.
Yes.
All right. So how to differentiate is the normal pain versus the pain that caused by a bone tumor?
Sometimes there is red herrings. It's like, doctor, I play football and I fell down when I was chasing the ball. And after that, my knee became very painful. Right. So I went to the doctor gave me some medication, it doesn't work. you know, and then after that, you know, I went for some massage, and then I started to notice that there is a swelling beginning to form around my knee, and I have difficulty in walking. I wake up at night, I cannot sleep, you know, things like that. So
the painful come with the
sometimes,
swelling.
Sometimes there is a red herring, something happens.
I understand.
Or sometimes it's just slowly, insidiously, slowly, gradually, the symptoms become more persistent and increase in severity.
I understand. Yes. I think it's quite difficult to visualize it. Why don't let us to watch some photos, and so Dr. Chai can further explain how a bone cancer looks like, or bone tumor looks like. So let's, director, please show some photos for us to explain. So this is what kind of bone cancer? This
is a cancer from the bone tibia.
Tibia, all right. Yeah. So it apparently is swelling.
Yes, it's a swelling.
I see.
Yes.
Okay.
Yeah, and patient has difficulty walking because of pain and swelling. All right. And this tumor affects the blood vessels in the back of the knee. So there are some numbness in the leg as well.
Even numbness. Yes. So is this considered late stage?
This is quite big. This is not
late, middle.
It is okay.
It's okay.
It's still resectable and
I see. So it's quite obvious. It's not like, you know.
Yeah, there are some tumors who grow to very big size.
I see.
In a very short period of time.
Let's move to the next photo.
Yeah, this is a bone cancer from a distal femur, a lower end of the femur, the thigh bone. This is a child.
How old?
I think the child was about 5 or 6.
5 or 6.
Yeah.
So in other words, just now we have mentioned there is no different. I mean, for bone cancer, a young age a kid can get as well.
Yes.
I see. Okay. Next, move on to next photo.
This is a soft tissue tumor. This is not a bone tumor, but this is just to demonstrate to the audience that, you know, sometimes swelling can really become very big. This patient kind of ignore his swelling for a long
time. Yeah, so this is considered late stage now.
Yeah, so things
like that.
Okay,
Okay, let's move on to the next photo.
This is a young boy with Ewing sarcoma of the humerus. Ewing sarcoma is a fairly common primary bone cancer that occurs in mostly adolescents.
Oh.
So this boy, I think he was in his 14, 15 when he came. This is a very aggressive bone tumor. Yeah, right. Ewing sarcoma.
Ewing sarcoma is quite aggressive. Yeah. Okay, thank you, Dr. Chai. And as a matter of fact, we also, you know, for our audience a better understanding, actually, some of your patients is so willingness to share some of this information with that. And then coincidentally, one of them is a young boy as well. Yeah. When he got the bone cancer, he's only 16 years old, which is Yong Kai Wen. Let's watch his testimonial video, and after that we will discuss further what is happening.
I sustained an injury, then after that I went to a Chinese traditional doctor to get it fixed. Then after a few days, I thought my injury is okay, then I did the training again, then after that it just got worse from there.
So, Dr. Chai, when he was 16, what kind of bone cancer did he get?
He has, Kaiwan has osteosarcoma.
All right.
Osteosarcoma is the commonest bone cancer, especially in the young age group.
I see.
Yeah.
So, how did he come to you? I mean, how did his parents come to see you? Based on what symptoms?
He came with pain and swelling.
He came with pain.
Yeah.
All right.
Persistent pain and swelling that is not getting better.
I see.
Yeah.
So at that time, what stage was his osteosarcoma?
He has a stage 2B. It's a staging system we call the Anakin staging system. Stage 2B means the tumor has broken out from the bone, invaded the surrounding soft tissue, but he has no distant metastasis. So only a localized disease.
I see, I see.
Yes.
What kind of diagnosis has been performed on him?
He came with the swollen thumb actually.
Thumb.
At the base of the thumb.
Right.
So X-ray already shows some very distinctive changes,
right,
suggestive of malignant bone tumor. So the next thing we did was we proceed with the MRI of the hand, and that show us the bone changes in detail, and this is followed by biopsy of the tumor, and the biopsy sample was sent to the lab. The pathologist reported it, and it came back as osteosarcoma.
I see.
Yeah.
Then after that, what kind of treatments that
for osteosarcoma, the immediate treatment is not surgery. For osteosarcoma, the immediate treatment is what we call a neoadjuvant chemotherapy. Neoadjuvant means chemotherapy that is given before surgery. The purpose is to kill the cancer cells first before we do the surgery. So he had he completed his neoadjuvant chemotherapy, and then we had a repeat MRI to assess the response of the tumor to the chemotherapy, and we planned the surgery for him. Then we did the surgery.
So the surgery actually, what kind of surgery that has been performed on it? Is that any resection? What kind of resection?
Okay. 𝗖𝗿 was very lucky that his tumor was completely confined to the bone in the base of the thumb that we call the metacarpal. So we excised the entire metacarpal, okay, and I harvested the bone from his iliac crest. Iliac crest is the bone in the pelvic bone, okay, which happens to be a very solid and strong bone that has 3 sides, very strong cortex. Harvested that bone and reconstructed that missing bone.
I see.
Yeah.
So in other words, we pluck from somewhere and put it in the place where it's needed.
Yes.
I see, okay.
And we use very precise plates and screws to secure and fuse the joints.
So that tells me that it has to be the doctor who performed the surgery has to be very highly skilled. No wonder only 2 to 3 doctors, full-time doctors in Malaysia, and the whole world only 500 bone tumor surgeon.
It is technically very challenging, and you need a very meticulous, somebody who can endure long hours of surgery and still very concentrated, very fine work to have a good result.
I understand. What is your average hours for an operation?
For me, 3-4 hours is very short.
It's very short.
5-6 hours is
normal,
pretty common.
And then what is the record?
I just did a 13-hour surgery 2 days ago for a 15-year-old boy. That's considered quite long.
Okay.
Yeah, but not the longest.
No, longest. What is your longest?
The longest surgery I had was with a combined plastics and vascular surgeon on board. It lasted 36 hours.
Non-stop?
Non-stop is like a marathon.
Right.
Yeah.
So can you please imagine, right? If you drive from KL to JB, it takes about 4 to 5 hours.
Yes.
Some of us can't even drive straight from KL to JB. You have to make some few stops. But Dr. Choi actually has performed an operation for 36 hours with constant attention to the patient, and like you said, have to be meticulous.
Yeah.
That is not easy, and that also tells that how much experience, how professional is Dr. Choi. And then Dr. Choi, we will make some answer some questions. There are questions from our audience. Okay, from Jean, she asked about the chemo and radiation. It is good to the patient and can treat the cancer is a question. What she was asking is the chemo and radiation good to cure to treat the bone cancer?
Most of the time, chemotherapy is used as a neoadjuvant and also an adjuvant chemotherapy with surgery in between. So before surgery, we had neoadjuvant chemotherapy to try to shrink the tumor, to kill as much tumor cells as possible. And then we had surgery to resect the tumor and reconstruct the affected part of the limb. And then after the patient recovered from surgery, we will proceed to adjuvant chemotherapy, which is very important as well. So this is the usual kind of flow of the treatment algorithm. There are very rare tumors that may just need only chemotherapy with no surgery. Sometimes like multiple myeloma, which is actually a very common hematogenous kind of tumor in the bone. Sometimes patients just go for chemotherapy and that tumor cells die and then the bone recover sometimes, but rarely, okay? So there is higher chances that the patient will need surgery on top of neoadjuvant and adjuvant chemotherapy.
Understand. So we have a second question from our audience. Hi Doc, what are the potential side effects and risks of each treatment? Let's start with the surgery.
The most important thing about tumor surgery is that you have only one chance to get it right. The subsequent, if you kind of screw up the first surgery, the subsequent surgery will be very difficult with a lot of complications and you need to sacrifice a lot of important structures. So the first surgery must be well done. So it has to be a wide excision. We are talking about bone cancers. So bone cancers, you need wide excisions with a clear margin. So that is very important.
So so it sounds like you must go to the right doctor at the very beginning to make sure you got the comprehensive diagnosis, comprehensive treatment. And what would happen if the first one was poorly done?
No, the thing is that when the patient first presents to the doctor, the doctor must be able to recognize that something is very wrong with this patient. Okay, so sometimes what the mind doesn't know, the eyes will not see.
I understand what
okay,
you're saying.
so the doctor must be able to pick up and realize something is very wrong, and he or she must know what to do for this patient to collect vital information to lead to proper, correct treatment and things like that. So what are the investigations that can be done? It's very important. Are these investigations done properly? You know, for example, sometimes an X-ray followed by an MRI. Is it a good MRI? Is the MRI clear enough to see what is happening? And then subsequently, the step after MRI is usually a biopsy. Biopsy is very important to know what is actually happening. What tumor is it in the bone? You must know your enemy before you start fighting a war, because you need to prepare your weapons and
you have the right
things like that.
generals.
And there's a lot of preparation before treatment can start. So there's a lot of the strategy, the planning is very important. And then the histopathology must be well read. If the histopathology is wrongly reported, everything will go wrong. So you need a very good radiology with good radiological equipment to give you good image. You need a good histopathologist to read the specimen and come out with a correct diagnosis for the patient. Then the surgeon or the doctor treating the patient must know what to do after that. He must already have a plan, you know. Then after that, the patient must understand what is happening and willing to undergo that. Then we may also need other doctors on board. For example, an oncologist. An oncologist play a very important role in co-managing the patient many a time. So a good oncologist on board is also very important. So there are a lot of preparation, a lot of data collection before we can actually say, okay, we go for this chemotherapy or we do this surgery for you. This is how much we need to sacrifice. How can I reconstruct for you? What is the consequences if we remove this? What is the consequences if we don't remove this? You know, and how are we going to reconstruct? What is the recovery, right? So it's a very, very long planning.
I understand.
So only a well-trained and experienced oncology surgeon knows how to deal with all this, because oncology surgery is very, very complicated.
I understand.
Yeah.
So it sounds like for a comprehensive treatment or diagnosis, actually it requires a cross-departmental collaboration. So it's not one general to fight the war.
It is almost impossible for the surgeon to function alone. So it is very important the patient is able to have access to many other disciplines. The very common important discipline in our kind of work is oncology.
I understand.
And oncology involves chemotherapy, radiotherapy sometimes, and nowadays we have targeted therapy, immunotherapy. And we need sometimes the plastic surgeons to come on board. Sometimes we need the vascular surgeons, you know. Very rarely we may need some interventional radiologists.
I understand.
And of course we need very good rehab team as well.
Right.
For the rehab. Yeah.
So it sounds like what Dr. Chai just mentioned, all the services actually provided at Sunway Medical Center, because we have consultation, diagnosis, treatment.
Very comprehensive.
It's very comprehensive. Even the post, you have the rehabs center as well. So it's
So I always tell the patient that when you are fighting a war against cancer, the patient himself or herself does not know how to fight this war.
Right.
And to fight every war, there must be a strategy. Otherwise, you run a high risk of losing the war. So you need a very good general.
Right.
So the doctor, the surgeon, is a general who will bring along his or her soldiers to fight this war for you. So finding the general, the right general who can fight the best war is the most important, because it can be life-saving.
I understand. So it's very important you always have the right doctor to fight the war along with you. All right, let's answer the next question from our audience. Jessie, she asked, bone cancer only occurs in the limbs. Can it happen to other bone parts of the body? So pretty much her question is bone cancer only happen on the limbs only? No. Which part of the body actually will have the bone cancer?
Okay, the commonest place for primary bone cancer is around the shoulder, okay, and around the knee.
Shoulder and around the knee.
Yes. Okay. So in the shoulder is like a proximal humerus. Okay. In the knee is like a distal femur, and also a proximal tibia, just around the knee. That is the very common locations for bone tumors. But there are other places. The pelvic bone is also not a very rare place, okay, to have bone tumors. We even have bone tumors in the ribs. We have bone tumors in the scapula. We have bone tumor in funny places. For example, like 𝗖汶is very rare to have a bone tumor in the hand.
And the thumb, right?
In the thumb is very rare.
Right.
And for the metastatic bone tumor, it can happen anywhere, okay, along and very commonly along the spine as well, in the pelvic bone. So metastatic bone tumor is entirely a different story. Yeah, but for primary bone tumor, it's very common around the shoulder and around the knee.
All right. Yeah. So let's move on to the next question. We have quite a lot of questions. So if I cannot ask all of the questions, please forgive us. But the next question I picked from our audience is, she wants to know, is there any test we can do to help them to prevent bone cancer?
It's very hard to prevent bone cancer. The more important thing to do is to recognize that something is wrong with the patient. It can happen in the bone, and do an early investigation. So if we can investigate early, we can pick up problem early. So for bone tumors, the easiest and most accessible task to do is a simple X-ray. Yeah, if you see something, some changes in the bone in the X-ray, there's already something really happening inside. So if you pick up that, the following test is usually an MRI. Yeah.
So it should be
but
done.
Sometimes, if the X-ray doesn't show any obvious changes, but the symptoms is persistent, then sometimes it warrants an immediate MRI scan to find out what is actually happening.
I understand. So like the symptom that we mentioned earlier will be the pain and also the swelling, and it can happen at any age.
Yes.
Okay.
Yeah.
All right, and then let's pick the last question. For now, we will continue answering the question later. Can bone cancer recur even after treatment?
Yes.
Yes, but we have a lot of success story.
The thing about bone cancer, I mean, if you do a surgery, the planning before the surgery is vital. So, you know, for the surgeon to study the MRI properly, MRI is a 2D image, but for the surgeon, what matters is the 3D situation. So that how far to resect, what can be preserved, what cannot be preserved. Sometimes we have to do the evaluation on table as we cut, and that kind of evaluation and execution of the decision of the surgeon on table is vital. But this is always supported by a good MRI image before the surgery. So a clear excision margin is vital to prevent recurrence. But if a good surgery is done and there is no recurrence, doesn't mean that the disease will not come back. Sometimes the disease will still come back as a distant metastasis to elsewhere. Yeah. Like the lung usually.
But we do have a lot of success stories. As a matter of fact, I would like to show a video. Also, one of Dr. Chai's patient. Her name is Melanie C, and then she actually is clinically cleared from the bone cancer. The bone cancer she got was a chondrosarcoma. Let's watch the video.
So when I first discovered my cancer, it's in year end of 2021. I would say November. Through an accident, and I got painful. I went for a massage. Then the kakak actually realized there's a bump. So 10 days later, the bump was starting to feel like there's pulse. It's painful lah. So I actually went to the ER and get X-ray, and then that's how it all happened.
All right, and that is Melanie. And earlier we have watched Kaiwen's video. He got the osteosarcoma.
Yes.
And then Melanie got the chondrosarcoma. What is chondrosarcoma?
Chondrosarcomas are malignant bone tumors that originates from cartilaginous cells.
All right.
In the
What's
bone.
That mean? Oh, okay.
Yeah, so our bone has a lot of other cells other than bone cells. So sometimes cartilaginous cells can turn malignant and grow in the bone. So it becomes chondrosarcoma.
I understand.
Yeah.
So, which part of her body got the chondrosarcoma?
Melanie has left proximal humerus,
Which
is around the shoulder.
Around the shoulder.
Yeah.
Which is, just now you mentioned, usually if you have the bone cancer, it's either your shoulder, arms, or your knee.
Yes.
Yes, okay,
Yeah.
I understand. So what symptom did she have at the time?
She had pain. I think she went for a massage, and and the masseur picked up. It's like, oh, there is a bump in the shoulder or something like that.
Oh, that's very professional of the masseur, because at least the masseur told her that you have a lump. So that alert her to come to see you.
Yeah.
I see. Then what kind of treatment has she undergone? Has she done?
The X-ray was actually very
obvious
that there is a tumor growing there. The MRI confirmed it and showed the extent of the involvement. She had a biopsy which confirmed the diagnosis of a chondrosarcoma, And after that, we had the surgery to excise the tumor and reconstruct the humerus.
I understand. And then, okay, so at the very beginning, we have mentioned that at different age range, you might have different bone cancer. And then at the younger age, the most common one is osteosarcoma and chondrosarcoma. And the older adults, it will be metastatic. Can we further elaborate, can doctor further elaborate metastatic disease?
There are a lot of cancers that can metastasize to the bones in the body. It is very common for breast cancer in the woman and prostate cancer in the man to metastasize to the bones.
I see.
Yeah, there are also, of course, other cancers like thyroid cancers, which is also not very uncommon, and also kidney cancer.
Okay.
Okay. To metastasize to the bone. There are, of course, other cancers that can metastasize to the bone, but these are the common ones.
All right.
Yeah.
And then, actually, as a matter of fact, we have a patient of yours also have this metastasis diseases through the MP.
Nasopharyngeal
yes,
carcinoma.
Correct. So let's watch a video. Mr. Hu, this patient is Mr. Hu. Let's watch his testimonial video.
那时候我就做了很多运动嘛，又打羽毛球，又打这个泰拳，然后又去 gym。那时候我很 fit 嘛，突然间腰痛，那一痛就痛了2-3个月都不好哦，看了中医，看了铁打都没有用，那结果就到了医院做一个 MRI， 就发现在我的盆骨有一粒6 cm 大的肿瘤。 那时候就确认了我有这个鼻咽癌了。
So this case is quite interesting, as mentioned earlier. Originally, when he first diagnosed, actually he found it in his iliac,
around
the hips, and then after that, but after further diagnosis, found out that actually he had the MPC. So how did you trace all the way back to the MPC, doctor?
Sometimes a patient presents with something which is actually a metastatic lesion without knowing that they have a primary tumor hidden somewhere.
So he never thought.
So the job of the doctor becomes like a job, like a CSI job, trying to hunt down and trying to search inside the patient. Where is the primary tumor? So sometimes a patient can even present with a fracture. You know, it's like an elderly person had a slight fall and then fractured the hip. So sometimes it can be a pathological fracture, which means the fracture occurs in the diseased bone. So it's very common actually. Okay, and then when you realize that this is not a simple osteoporotic or traumatic fracture, but this is a diseased bone that has fractured, then things become more complicated and you have to start to diagnose what tumor is this that is involving the bone, and if this is a metastatic tumor, where it is coming from. So usually we will need a very extensive scanning of the patient, and we are very lucky to have very good nuclear medicine support in this hospital. So we have a very advanced PET-CT, positron emission tomography scan that is really very helpful to do a thorough examination and evaluation of the patient. And sometimes the primary tumor is found when we do a PET scan, and that is how women's tumor was found.
I understand.
Yeah, so you do a good evaluation, a local evaluation of the tumor in the hip. For him, is in the iliac bone, okay? And we know exactly what is happening in the iliac bone. We do a biopsy, it confirms that this is a metastatic and not a primary tumor, okay? And then that PET scan that we do, confirm that there is a foci in the nose, behind the nose, and the ENT surgeon did a biopsy and confirmed that the lesion behind the nose is indeed the primary.
I understand. So
Yeah.
this exactly aligns with what Dr. Chai has said earlier. Actually, it's not one general to treat the bone cancer.
It's
because
never straightforward.
It's never
Yeah.
straightforward. You have to
Yeah.
trace all the way back. That's why the metastatic disease is considered as a secondary bone cancer.
Yes.
All right, understand. So let's take a break and answer some of the questions that we have from our audience. All right, this mister, he has a 17 years old grandson who has a bone cancer and has been undergoing 6 chemo cycle, cisplatin, and okay, quite technical.
Doxorubicin.
Has his 6 inches long bone taken out by surgery, replaced with titanium, and have his 3rd maintenance chemo next week. There is swelling on his operated right knee. The ortho doctor said it is normal. So what is your comment?
It's very hard for me to comment on that based on that information. The thing is that what is the swelling due to is very important to know. Is it a residual tumor? Is it a recurrent tumor? Or is it due to other things? It's very hard for me to comment. It can even be infection.
I understand.
Yeah.
And then this audience actually is from Philippines, Cebu City.
Yeah.
So is there any way to contact?
You need a proper examination and evaluation to know that what is happening, what is that swelling all about, is the disease coming back? So it's very important to have a good check.
So if he wants to see you, is there any way that he can contact through our website, the Summit Medical?
Sure.
So Mr. Reynaldo, if you would like to see Dr.
We have
Chai,
the International Patient Center that can help.
right.
Yeah.
So I hope that will help. If you need further information, definitely you can DM us, and then our admin will advise you how to get in touch with Dr. Chai. All right, let's move on to the next question. He asked, will baby be affected by bone cancer?
Babies are rare. I
I understand.
so far my youngest in the recent time, the youngest is a 3-year-old child.
The youngest is 3 years old. What
Yeah.
did he or she get?
Osteosarcoma.
Osteosarcoma also.
Yeah.
All right. And then there's a few questions from our audience. They want to know, where does the cancer come from?
The cancer has very complex etiology. Etiology means how it happened. Many of them has been traced to genetic mutation.
Oh, is it?
Yes.
Oh, okay.
Yeah, so the DNA coding has somehow switched or changed. We call mutation, and that leads to the formation of the cancer.
All right. Actually, one of audience asked that question. So, is that it will inherit? Is that a family history that will cause the bone cancer?
Very, very, very rarely we have inheritable bone cancers.
I understand.
Yeah.
And then next question, he asked, can bone spurs develop into bone tumors?
Bone spurs, no. Bone spurs, if it is indeed bone spurs, is actually a reaction of the bone to some other pathology. Sometimes it's inflammation, sometimes it's degenerative changes around the bone or around the joint. Bone spurs do not change to bone cancers, but osteochondroma, a very common benign bone cancer, does have a potential around 10% that may turn malignant. So some benign bone tumor can have what we call malignant transformation. So you have to be very alert sometimes.
All right.
Yeah.
There are also quite a few questions to ask. I believe doctor have answered, but maybe you need to answer one more time.
Yeah.
This audience asked, she said, prevention is always better than cure. So she asked, is there any test or screening she can do to prevent or to have an early detection of the bone cancer?
I don't think there are any screening for bone cancers, like maybe like breast cancer. You do screening,
Yes,
like
this is exactly what she said.
regular mammogram, ultrasound. But there are so many bones in our body, and nobody has really have any screening program for bone cancer. The more vital thing is that early detection and recognition is very, very important. The problem with patients is denial.
Oh, yeah.
They are very scared. They were very scared to find out the truth.
Understand.
So they kind of like, okay, let me hold on and see what happened. So they delay.
Understand.
So a delay sometimes is fatal.
Understand.
A denial can be fatal.
Right.
So you need to take action when the body is sending signal to you and say, hey, you know, something is happening in your body. Please check it out. You know. So you need to heed that warning and that signal and take appropriate action. Go and see the right person. Seeing the right person in the right setting is very, very important. If you see a wrong doctor, I have so many patients that come to me with fairly advanced or extensive tumor, and then they told me that, you know, doctor, I went to this place, that clinic, that medical center, and then the doctor said, it's okay, you can just keep it, watch it, it's harmless. And many a times those tumors turn up to be malignant tumors.
I understand.
Yeah.
I always love to use my late sister case. She has a breast cancer. Actually, at the early stage, it can be is curable.
Yes.
It can be treated, but because of the delay of a
Yeah,
denial.
the common kind of like people want to believe is that when you have cancer, that's the end.
Never know.
That's the end of
Yes.
you. No, it is not. Cancer is very, very treatable and very, very curable.
Right.
If you detect the cancer in the early phase, okay, and do the proper investigation, proper treatment, everything goes well, many patients can be cured and life can go on.
Right.
So it's not the end of the
world,
world for the
yes.
patient. And please do not like hide and stay away, you know, and not do anything. Please do something when you realize that something is not right. You know?
So what in speaking of that, right, what would you advise if somebody finds something wrong, or if they have some pain in body that they can explain, or, you know, not responding to a simple treatment? What would your advice to them?
The common problem with Malaysians is that
没有检查就没有事。
patients like to self-treat sometimes, you know,
right,
and we have so many pharmacies. They like to go to pharmacies, buy some painkillers, you know, and things like that, and treat themselves. And when they cannot handle it themselves, we have so many GPs. So GPs are very vital for picking up the cases. You know, but sometimes cases are missed by the GPs, and many of patients, they just let it be. You know, so sometimes when things doesn't get better or it get worse, it is very important to seek professional help. Yeah, specialist help. So good consultation and examination is very, very important.
I understand.
Yeah.
And then because, you know, it's always start with the diagnosis. Once you have a proper comprehensive diagnosis, then you only can lead to a comprehensive treatment.
Yes.
And speaking of treatment, actually we have prepared some of the photos of the resection that doctor has done. Let's show some of the photos that Dr. Chai has performed. Okay, this is the left one is a post surgery, right?
Yes.
All right. The
Yeah.
right is the X-ray.
Yes,
This is
that-
what kind of
that-
sarcoma? What kind of bone cancer is this?
This is osteosarcoma.
Oh, osteosarcoma.
Yeah, so
Okay.
that is an autograft reconstruction. So taken from this is iliac bone. So
Oh, the iliac bone.
Yeah.
Taken from the iliac bone and then replace it in the
yeah,
tongue.
correct.
I understand. Let's move on to the second photo.
Yeah, this is osteosarcoma of lower end of the tibia. The lower end of the tibia is is a very difficult place to reconstruct because of the anatomical kind of features. So this is a very difficult surgery. Most of the time in the older days, these were warrants an amputation. Nowadays, we have very good technology. So this patient has osteosarcoma of the tibia. She underwent neoadjuvant chemotherapy, very good response to the chemotherapy. And then I excised the tumor. And on the left, you can see that it was reconstructed with very unique prosthesis.
Oh,
Yeah.
What is prosthesis?
Prosthesis is a metal prosthesis that is used to replace the resected bone.
Okay, understand.
And there is no like modular prosthesis for this type of reconstruction in the market. So this prosthesis for this patient is specially made for her. And this prosthesis is 3D printed. So this is a very rare kind of prosthesis. Is precision to the max. Otherwise, the fixation, the angulation will fail. So everything must be very well planned. So I planned the resection. I measured the bones and the angles and the size and everything, and then come out with the drawing. And then the engineer 3D printed this prosthesis for us to make this reconstruction possible.
I understand.
Yeah.
So let's move on to the next treatment, the next resection that Dr.
Yeah,
done.
this patient came with a very high-grade chondrosarcoma involving the entire humerus.
Oh,
Yeah.
entire.
From the top to the bottom. So there was no choice. And for chondrosarcoma, there is no chemotherapy or radiotherapy. The only way to treat this cancer is a good complete excision of the tumor. So he underwent a wide excision of the humerus with a total humerus reconstruction.
I understand.
Yeah.
Okay.
So we replaced the whole bone.
I understand. So those are the examples of the operations that resection that Dr. Choi have done. Okay, let's answer one more question from the audience. I think we kind of mentioned it throughout the show, but let's say it again because it's vital for a quiz later. All right. He asked, is bone cancer more common in certain genders or ages?
It is not a very obvious things like gender
or ages.
Division. For us, it's almost the same. Very few tumors that has occurring in more male or female. Okay, not very, very obvious. So it's kind of like almost the same. Ages, yes. Yeah, for osteosarcoma, like I said, it occurs mostly in the younger age group, growing child, adolescent. Of course, it can still happen in people in their early 20s. Okay, chondrosarcoma usually occurs in the older age group.
Understand.
Okay, Melanie is quite young, so she's a bit young for chondrosarcoma. But the trend is that cancers are occurring younger and younger in our patients. And the Ewing sarcoma is also another sarcoma that occurs commonly in adolescents, things like that.
So in short, actually,
but metastatic bone tumors are
older adults.
More common in older adults, but it is also happening in young patients. For example, 2 days ago, I just did a young boy, 15-year-old boy with metastatic nasopharyngeal carcinoma in a 15-year-old.
Which is not common.
It's very rare. It's very rare. But it is happening, so you must have the high index of suspicion. So we pick up the metastasis in the bone, and it is in the whole bone. So again, this is another big surgery. So we just did wide excision and a total humerus reconstruction for a 15-year-old boy with a metastatic nasopharyngeal carcinoma. But usually it occurs in the older age group.
Understand. But in short, bone cancer can occur at any age.
Yeah, the spectrum is very big.
Yeah, the best spectrum is very big. It's just like at different age range, you might there's one most common bone cancer.
Yeah.
So it's, in other words, it doesn't hard to say that it's only happened to certain
Never
age
say
range.
never.
Yeah. So it's literally any age can have bone cancer. All right, with that being said, actually it leads us to the quiz segment, right, Dr. Chai? As mentioned at the beginning, you know, I will ask 3 simple multiple choice questions. If you have been following our FB Live today, it's Kacang Putih, you should know the answer. So this is how we're going to play out, right? I will ask Dr. Chai to pick a number from 1 to 25, right? And then Dr. Chai will pick a number, and the number that Dr. pick, if same as the number of the right answer, you are the winner. Like give an example, if Dr. Chai pick from 1 to 25, she pick 20, then I will ask a question. The 20th person who answered the question correctly is the winner, and that he or she will get the 100 ringgit Uniqlo gift card. I hope that is clear. So we'll play out this to make sure that's why we're doing this way. We want to make it random to be fair to everyone. Of course, first thing, you must get the answer right. Second thing, your number is same as the number that picked by Dr. Chai. So for the first quiz question, Dr. Chai, from 1 to 25, what number would you pick?
18.
Okay, 18. If you are the 18th person who answered the question correctly, then you will walk away with 100 ringgit Uniqlo gift card. All right, now here is the first question. Get ready, guys. All right, please type your answer in the comment. Start with Q1 and then give the answer A or B. You must be the 18th person who answered this question correctly. Okay, bone cancer only affects older adults. True or false? Bone cancer only affects older adults. True or false? So please write Q1A or Q1B. All right, it's very simple question as we have been talking about throughout the show. You know, bone cancer can happen at any age. It's just at different age. There is one most common bone cancer. For the younger age will be osteosarcoma, chondrosarcoma, Ewing sarcoma. For the older age will be metastatic. So, all right, it's very obvious. So let's see. Our admin will find out. While waiting, our admin to pick the 18th winner, there's one question that I would like to doctor to answer as well. This is the patient from the Philippines as well. I think he really makes sure his grandson has the right treatment. Additional question: are sugary food, fast food, processed food, soft drink are not good for osteosarcoma?
Yes.
How about shrimps, octopus food, seafood?
Shrimps and seafood, they are source of good protein. There is no contraindication, but I strongly advise patients to avoid refined carbo, processed food, and sugar.
I understand.
Yeah.
And then his further question, aside from GCSF, what is that?
GCSF is a medicine that used to boost the production of white blood cells when the patient is undergoing chemotherapy.
All right. He asked, aside from GCSF, what foods that will increase his CBC and others?
I will always say that eat natural food. A balanced diet is very, very important.
Okay.
Yeah. You need good nutrition when you're fighting a big war.
Okay.
Yeah.
Okay, for the first question, we have the winner, the 18th person who answered the question correctly is Nurul Ikin. Congratulations, Nurul. So our admin will contact you to get some of your personal information so we can send the Uniqlo gift card to you. All right, let's move on to the second question. Director, please don't show the question yet. All right, never mind. All right, so let's pick a number 1 to 25.
21.
Okay, 21. Huh? The 21st person who got the answer right will walk away with 100 ringgit Uniqlo gift card. Okay, what is the second question? The second question is, metastatic bone disease, also known as secondary bone cancer, occurs when cancer cells spread to the bones. True or false? Please write Q2A or Q2B. Alright, the 21st person who got it right will be winning the 100 ringgit Uniqlo gift card. So, can you please share some of the, beside Mr. Hu, can you please share some information, some cases that you have done before who has this secondary bone cancer?
There are so many of them.
Can
there
you
are
pick
so
one?
many of them. The
Beside
commonest
NPC and the
pool of patients that I get from breast cancer, lung cancers,
So they never...
prostate cancers. So the problem with there are so many of these people out there that so-called like they had undergone like breast cancer surgery.
Right.
They may be having some kind of maintenance therapy going on that they do not check themselves. And there is no assessment sometimes done for them at the regular interval. So sometimes it is not easy to get all this done sometimes due to various factors. But a regular monitoring of the disease progression it is very important, and it is also important for the patients to always keep in mind that there is always a chance that although the primary disease is kind of like resected, there is still a chance for the disease to metastasize to elsewhere. And a very common place for these tumors to go to are the bones. So sometimes a good oncology follow-up is very important, and the oncologists must sometimes have a very high index of suspicion. You know, like when the patients with the breast cancer start to complain about pain in the shoulder, pain in the knee, or pain in the back, that appropriate investigations is carried out for the patient, so that you pick up the problem when it is in the early phase, not when the disease is spread to everywhere in the body. Then it becomes kind of like futile. No purpose.
Right.
Yeah.
It's less chance. The
the chance
is
of
lower.
Achieving a good response or cure is almost impossible. There are some patients who are very lucky that they have this, for example, a breast cancer, that they only metastasize to one location in the bone. For example, a proximal humerus around the hip, and the patient has always pain in the hip, and they thought, I'm getting old, I'm having osteoarthritis. But sometimes it is metastasis to the bone, and if you are lucky, that affected bone can be resected and reconstructed, and you follow up with the oncology, and sometimes there are some other treatments for the patient, and after that the patient is cured. So even a metastatic bone disease is not the end of the world.
Understand.
You know?
Right.
Yeah, and for those that has advanced metastasis, it is also very important to have a proper evaluation, because even if it is palliative care, the quality of life matters.
True.
Yes.
So I echo that, reckon that the quality of life is definitely very important.
Yes, very important.
All right, we have the second question winner, and then the 21st person who answered the question correctly is Nurita Baran. Congratulations, Nurita Baran. All right, our admin will contact you to get your personal information so we can send the 100 ringgit gift card to you. All right, so before we continue our conversation, let's ask the third question first. Please don't show the third question. All right, please pick a number from 1 to 25.
15.
Okay, 15. Okay, because we're running out of time, right?
Yeah.
So, all right, the 15th person who answered the next question correctly will win the 100 ringgit Uniqlo gift card. All right. The third question: Which of the following is bone cancer? A. Osteosarcoma. B. Hemorrhoids. All right. So which one is the bone cancer? So easy, so obvious. And make sure you write Q3A or Q3B. All right, let's continue.
Yeah.
While our admin select 15th winner. So it sounds like, do you advise if a patient who has breast cancer, lung cancer, prostate cancer, should they go for the bone scanning, maybe screening or MRI?
The thing is that the awareness must always be there, that things like this can happen. So not every patient has the means and the access to a good quality healthcare. But if you have the means to have access to a kind of a good healthcare and a proper oncology follow-up, sometimes it is good to have a regular kind of like scanning, to make sure that everything is okay. Breast cancer does not only spread to the bones, it can also go to the lungs, it can go to the brain sometimes. So it is very good, a comprehensive follow-up and scanning sometimes does help. But I do understand that not everybody has that so lucky to have that ability to go for all this. But in case you have breast cancer, you have prostate cancer, you have lung cancer, and you start to feel uneasy or discomfort or even pain anywhere in the body, please go and find out, go and have a proper checkup.
Right. So there is a high probability that it's metastasized somewhere else.
Yes.
I understand. Okay. So we have the winner already. All right. For that question, the 15th person who answered the question correctly. Okay, please give me a minute because for some reason I cannot download the winner name. Can I have the admin to tell me who? I got it. It's the answer is A, of course, so obvious. Okay, as it's Muhammad Aizad. Muhammad Aizad, congratulations. So there are 3 winners that win Uniqlo gift card that's each worth 100 ringgit Malaysia. So I think that also comes to almost the end of our show today. So last question, Dr. Chai. Do you have any advice to our audience what they should do, to be aware of bone cancer?
It is very important to instill the awareness of the patients about the disease they are having, whether it is lung cancer, breast cancer, or prostate cancer. If they have all these cancers, to have a good checkup if they feel something is not right with them. And then if they do detect any problem, whether you are, regardless of the age group, please seek really professional help.
I understand.
Okay, because this is very important. If this is really bone cancer, or if this is really metastatic bone cancer, the chances are very, very slim sometimes if you do not get it right in the first place.
So must go to the right doctor.
So whatever you do, the first surgery or whatever, must be properly planned out. Before that, must have a proper investigation, executed and done by the person who knows how to do it and how to do it well, and willing to sometimes endure the long hours and do this to get things properly done for you. And it is also very important to do it in a place where the best equipments are available with the best kind of multidisciplinary team on board. Sometimes the surgeon himself or herself is unable to complete the treatment without the other professionals, the help of other doctors. So if the surgeon is good but you have a lousy oncologist, that also will not help. If the surgeon is good, but you do not have a plastic surgeon, a good plastic surgeon, sometimes it doesn't help. There are limitations. So everything must be as best as it can for us to achieve the best possible clinical outcome for the patient, because it is really life and death.
I understand. So in short, it has to be a comprehensive treatment, and if you can try to find a medical center that have all the services under one roof, like us, 𝗖𝗵𝘆 Medical Center. And one more thing I think Dr. Chai also has mentioned, it's very important to go to the right doctor at the very beginning. If you don't feel comfortable, that is not the right doctor, I think it's always can get the second opinions, which is good also. All right. So, all right, guys, with that being said, last advice from Dr. Chai, we conclude our session today. Thank you so much for staying with us until this last second. And I hope everybody learned something today. And I hope everybody is aware and understand what is bone cancer about. Till we see you next time, please take care and everyone has a great weekend. Thank you so much, Dr. Chai, to be with us today. And thank you so much, everyone, for watching until this second.
Thank you.